All right, welcome back to NPTE StudyCast. Today's quick hit, MCL injuries, what they are, the easiest way to spot them, and how to avoid confusing them with literally every other knee problem on the exam. I'm Jimmy McKay, and I know you don't have time, so I made this really, really short. Subscribe if you like fast answers and passing exams. Here's what an MCL injury is. An MCL injury happens when the medial collateral ligament gets stretched out or torn from valgus stress. Basically, when your knee says, I'm not supposed to bend that way, but thanks. Think your knee getting side hugged way too aggressively. Signs and symptoms. Here's the NPTE pattern for MCL injuries. Medial knee pain, pain with valgus stress, localized tenderness, mild, moderate swelling, often caused by a lateral blow. If the pain is on the inside of your knee, then your NPTE brain should whisper, probably MCL. Here's how you rule it in and how you rule it out. Here's how you rule it in. Valgus stress test at 30 degrees, MCL tenderness, and medial gapping. Here's your rule it out clues. Immediate swelling, that's going to point towards ACL. Delayed swelling with locking, meniscus. Posterior sag, PCL. And here's the NPTE trap to avoid. Valgus force plus medial pain equals the MCL. Don't let them Jedi mind trick you. It's the MCL. Here's treatment that the NPTE loves. Rice early, quad and hip strengthening, range of motion restoration, bracing if needed, progressive return to activity. NPTE hates overloading valgus early, ignoring instability, pretending this needs surgery. It usually doesn't. All right, buckle up. Here comes your mock NPTE question. We're going to keep this quick. A 22-year-old rugby player experiences a lateral blow to the knee. They report medial pain and tenderness along the MCL. Valgus stress test at 30 degrees is positive. What's the most likely diagnosis? I would normally give you a multiple choice, but this really should just be an MCL injury. You're seeing it there. Here's why. Lateral blow, medial pain, valgus test positive equals case closed. This is NPTE StudyCast. Everything you need to pass in under 3 minutes. Share this with your study group so everybody stops confusing valgus with whatever they're confusing valgus with.